like that. So I'm going to get started with a slideshow. Okay, so laser hair removal in our brochure is described as the safe, effective, long-term solution to unwanted hair for both males and females. Eclipse uses short, safe bursts of intense pulse light called selective waveband technology, often referred to as laser. Individual sessions are available and results can be seen just after a few sessions. A course of 6 treatments is recommended for permanent hair removal and reduction. This doesn't mean that 6 treatments will completely eradicate the hair. It is a form of reduction to the hair. So 6 is what is recommended. Some people will get almost a whole removal of hair in 6 sessions. Others will have to have a lot more top-ups, or will have to have maybe even 8 as their starting point for laser hair removal. It's good to know that and good to tell our clients that, because every individual is different with their skin tone, the colour and thickness of their hair, and what might work for one might not work for another, so just so you know. So the cost of a course of 6 treatments give you 6 treatments for the price of 5. If a follow-up appointment is required, possibly 6 to 12 months after, this is just a guideline again. Completion of the course, the follow-up price applies. If complimentary consultation and patch test is required at least 24 hours prior to your session and should be booked in advance. So it's so important with this treatment that we do a patch test, and it is a requirement. There is no ifs or buts about it. There is no disclaimer you can sign. You have to have this 24-hour patch test, and I'm going to go through the importance of having that patch test as well, because it is so important that all of our clients do have that 24-hour patch test before they come. So just be aware of that if you're a client, that you're going to have 24 hours. The first time I went to get laser done before I did the treatment myself, I turned up covered in fake tan. It was at my work Christmas party the next day, and I didn't realise you couldn't wear fake tan. So it would have been good to know that before I got to the salon. There was a few do's and don'ts before you get to the salon, and we've got them written down for you as well. But it was awful, because I was like, oh, okay, I've come all this way and I can't get the patch test. Now I'm embarrassed. I'm covered in fake tan for my work Christmas party. But yeah, they're just things to keep in mind. So moving on, this is the price list for our sessions. So as you can see, you've got female face, female body. So I didn't put the male up. Haven't got anything against it. Men are really hitting up for this treatment as well. Just wanted to make the PowerPoint as small as possible. But the prices are very similar, but obviously different areas. So let's go for the first one there. Upper lip is just 45 for the 1 session. You could get a quick reduction on the upper lip. It is a hormonal area of the lip. So you do generally need more sessions on, say, a lip than an underarm. I know you're going to say underarms are hormonal too, because we sweat and everything, but I don't know if it's just because I'm more grouped area, and obviously hormones do hang on to that lip area as we get older as ladies, but yeah, that area can take more than 6 for clients, so the clients should be aware that it's probably the main one I get inquired about is the upper lip for hair removal, that and Hollywoods. Some people for legs and full arms, but yeah, it's mainly lip, Hollywoods and underarms, I'd say. So yeah, anyway, £45 for 1 session. So the overall course is £225. That's with 10% reduction. And then after you've had the course of 6, like I say, for an upper lip you might need more than 6. Then the follow-ups would be a dramatically reduced price at 37 there, and that just applies over all of them. We do courses. I haven't put them on here, I'm afraid, but we have got course packages. So it might be that in your package you have your lip, your underarm, and your bikini line. The only thing to be aware with that is that any facial hair treatments compared to the body hair treatments will be differing in weeks apart. So your facial hair removal is going to be every 4 weeks, and then your body hair removal will be every 6. That's to get the optimum level of hair growth, and I'll show you that slide in a moment. But the hairs on our face will grow quicker, shed and create new hairs a lot quicker than the body hair that we have. Some salons and clinics will say, oh, just come in the middle at 5. But speaking to the trainers that I've trained with and things, I personally would prefer my clients to come every 4 weeks for the face and every 6 weeks for the body. I think you're going to get a better result and cost effective. If you're going to get a better result, you're not going to have to spend as much money on treatment. So that to me is a bonus for you guys as well. So next slide. So this is our broadband technology. So this is just our difference between a so-called normal laser machine and an IPL laser machine, and our particular laser machine, which is called the ND YAG. So that's here, and this is just showing where on the spectrum of light and compared to our bodies that this wavelength is. So ours is right here. So as you can see, barely any, if any, water absorption here. So this is H2O, obviously our water absorption. Okay, my next slideshow here is a patch test gone wrong. So whether the client wasn't aware that they had to stay out of the sun for their patch test, or it was occupational error. But this is just to show how important it is that we know how long ago it was that our clients were in the sun. So as you can see, our first one here, it's showing on our client here, our case study, that straight after the patch test, you can't see too much. So this client themselves is Chinese, so you can't necessarily tell the difference in a skin tan like you might on someone who is fairer skinned or even darker skinned. So there is very slight suntan here, a little suntan in the middle, and then no suntan at the top. You can see they have a natural scar there. I don't think the first picture, obviously the flash might have been on, you can't see the scar as well. But in the second picture, they're 10 minutes after, the patch test starts to show up here. There's a little bit of a darker area just there. And then as we get on to 10 hours after, later when the client's gone home, this is why we need to do 24-hour patch testing, and that we need to leave the skin to show up any reaction, that you've got his scar up the top there. They've got the little bit of the suntan there on the t-shirt mark, which is just slightly red, and then where the sun has definitely hit the skin there and is suntan, that it is got a lot darker. Obviously different conditions, you can see that this first picture you can't see the tan as well, whereas you can definitely see the tan line on this area of the skin is darker than this one. So the therapist would have seen that difference. Maybe this was just to show why it is so important, because we'll also get clients that go, oh no, this tan is definitely old tan. I have not been in the sun for 30 days, my melanin isn't active, I don't need to worry. So that is what it is if the melanin is active within 30 days of them being in the sun, we can't treat. If they have got existing old tan, we can just put on our system that they have a medium tan, and that that's absolutely fine. If they can keep an area covered and they have a tan that their whole body holds onto tan, that is fine. It is about the active melanin in the body. So you don't have to stop your tans, you just have to have 30 days either side of treatment. So yeah, as we see, it gets darker. As you see, 4 days later, it's getting not necessarily darker, but it's starting to flake, that area that was affected. And then 10 days after, it goes lighter. It almost goes like a scarred colour. And then 3 months after, it's barely there. So it does heal, but we want to avoid this at all costs. We want to stop any sort of burns, and especially on a client who's already visited us, definitely need to know if there has been any extra sun exposure, because we don't want this to happen to our clients. So hopefully that helps you see the cycle of a unfortunate patch test burn. So this is just showing obvious results and what the skin might look like after treatment. So you have a standard clinical reaction, a little bit of redness on this man here on his back. You can see that the other side of the skin is a little bit lighter, and he's just got a bit of erythema there, so a bit of redness to the skin. Same for this gentleman who's getting his underneath his neck done here. Where the red dots are, that's just us guidelining where we've been. It is just a little bit red. That's completely normal reaction. We want that. What we don't want is a burning sensation. And we don't want some obvious darkening showing on the skin. So that's why we're testing, always asking our clients, can you give us a level of 1 to 10? How's that feel? If they've been with us before, they should know, oh, okay, yeah, that was tender. Our first session will be a lot slower. We will check with you constantly. How does that feel? How does that feel? Because you're not going to know what to expect. After a few more, we might say, how does that feel on your first 2? Okay, we can continue. Especially if it was an underarm, we'd know if it felt different to before. We'd say, oh, let's have a little minute just to make sure the reaction's the same, and us as therapists can check along with our clients. And then this end one is a normal edema. So it's normal when the hair follicles can poke up like that, but it can also be the sign of a bad reaction. So if you get a little bit of prickling afterwards, we would just check the area, make sure the hair follicles themselves are okay. This is why we want a nice close shave before. We ask our clients to shave the night before or the day of their treatment, because we don't want them hair follicles to be too raised and bumpy, a bit like a plucked chicken. Some of our clients can go like that, and that can be a normal reaction. They can also be the signs of a not so good reaction as well. So that's just things to look out for. So our salon pre-treatment instructions. It is important that you avoid the following within 30-day period prior to treatment. Do not sunbathe. We've just seen why. Do not use sunbeds. We've just seen why. Avoid self-tanning products, or you will be like me and get turned away. Do not have electrolysis. That is obviously a treatment that is going to go against what we're trying to do. Do not wax. Again, we don't want the hair out of the follicle because otherwise it can't be treated. Do not pull out any of the hairs with tweezers. So don't go plucking away your chin hair and go, oh yeah, there was one here that I want treated. Can you get that? Because if it's not in there, we can't treat it. Do not thread or bleach any of the hairs. So again, threading, taking away, bleaching, you're colouring that hair, so we're not going to find it correctly. And do not use hair removal creams. So that can sometimes even get into the follicle, even though they say it's just on the skin surface. You know how you still get smooth? I think if it was anything but shaving, where you can still feel a little bit of stubble, it's not going to work. The treatment's not going to be effective. Shave as close as you can on the next treatment time as possible, and leaving a small patch of hair, approximately 2 millimeters either side, in a little box, or 2 days of hair growth for visual assessment. So it's always good if you're coming in to leave a little patch area that we can see, even if it's just a few hairs, so we can test that the hair color is right, that we can test the hair thickness, because on our system that's what we're putting. Post-treatment instructions. It is important that you do the following for the next 30 days after your treatment. Avoid sun exposure on sunbeds. So same thing, don't want to go and have a heat treatment straight after you've had this, and you want to leave 30 days on that area in particular before your next treatment. If you're going out to the park and you're getting your arms all nice and tanned, your legs nice and tanned, and you're not having treatment on them, and you've got a top on like myself today, and you're having your underarms and your bikini done, absolutely fine. You can still go and enjoy the sunshine that way, but we don't want sunshine on the areas that are being treated. Obviously this treatment is a lot better in the winter months, or months that you're not going away on holiday, but that's something to discuss with one of us therapists. Wear an SPF sun protection or higher whenever you're outside after the treatment, on them areas, again with caution, but I suppose underarms, if as long as you're not getting them too in the sun, if you've got a top on like this, you probably wouldn't need to put SPF on them, but just be aware. And it is important to avoid the following for 24 to 48 hours after treatment. So try not to use perfume products or makeup on the area. It can be hard on the lip and chin area, mineral makeup if you must, and no excessive heat, sauna, steam rooms, hot baths, showers, jacuzzi. Avoid swimming, avoid exercise. What a shame for a few days after. No, honestly do. Another story I've got that I tell all my clients is that I went to the gym and thought it was okay after a laser treatment on my bikini line. Was in the gym for the first half hour, absolutely fine. Had the treatment in the morning, so couldn't feel anything. You can't feel anything pretty much straight after you've had a laser treatment. All of a sudden in the gym, my eyes start to get really hot down there, just really, really hot. And I was like, oh, okay, forgot about the treatment this morning. I'm going to get off. Luckily, it was a nice cold day outside. It stopped my workout short, which I was probably quite pleased about this at that time, trying to get out my workouts. But yeah, it was just a bit warm. So I managed to cool it down. And if that does happen to you, we always say cold compress, aloe vera, which we will apply at the end of a treatment. We would put aloe vera on any area that we've worked on anyway. But yeah, so just go home, put aloe vera on the area. I was absolutely fine. No extra precautions were made. I just needed a bit of cold air to the area and just put some of my own aloe vera when I got on up at home. But I know that is what I had done. I just got my body a bit too hot after that treatment. So just be aware of that. No touching, picking or scratching the area. Don't go home and start itching whichever area you've had, because it's just going to cause more friction on the skin there, and could cause some damage. Okay, and please note the only method of hair removal that is suitable for use in between treatment is shaving. Do not wax, do not tweeze, do not thread, and do not pull the hairs. Do not use bleaching or hair removal creams. If any inflammation occurs during 48 hours after treatment, you should use aloe vera gel, like I just said, and a cold compress, and you should contact the salon if this persists after 48 hours. Let us know, obviously, and if it was particularly severe, you'd have to obviously talk to a doctor. But this is why we do patch testing, and we can explain all this to our clients so that hopefully there wouldn't ever be the need for a doctor. Okay, so this is a quick 10-second video of what happens in the treatment. If you've had it yourself, you will know, girls. But this is just to show it from the perspective. At first, I thought this was a lady's knickers. I thought this was a lady's knicker line, and she was working down there. But it is actually the underarm area after I looked a few times. So yeah, here we go. So I don't know if you heard her at the end there. She goes, "Oh, Jesus Christ." So it's as though she's not enjoying it, which some clients really don't enjoy having this treatment done. Not to put you off, but it isn't the nicest feeling. We describe it as a hot elastic band being flicked against the skin. Each time you can ask us to stop, but a treatment like the underarm area can be as little as 8 shots each side, because we've got quite a big head. It's about the size of this. Actually probably more like this end. It can just be a small area that we treat with a big head, so it can take really, really short amount of time. This area here is particularly sensitive. The underarm can be sensitive, the bikini line can be sensitive, legs not so much, don't seem to hurt clients as much, and then the lip obviously can be a little bit tender. Arms, again, clients don't seem to be too upset with. But yeah, so we would sometimes mark out this area just so you know as well. This lady's just got a bit of tissue tucked under her bra strap there, so that's just, and she's helping stretch, which will just help her feel a bit more comfortable, but a bit like if you're having a wax. But I'm just going to play it once more so you can see how she moves across the skin, how she tries to keep overlapping. Might have heard her whisper there again. So who is this treatment for? Women and men. We have just as many men come through the door and have this treatment as we do women. And children, no. But we can treat from the age of 18. It might be worth coming and asking about the treatment before then, but because of your hormones, we wouldn't treat anyone underneath the age of 18. And I think that's a good practice to have, basically. Skin types as well, every skin colour, every skin type. So on Fitzpatrick 1, so being a very light client with fair skin and light hairs, as long as they've got some pigment in the hair, we can treat you. So black or brown pigment in that hair, it will treat you. It might not be as good a result as someone who's got fair skin and dark hair, because that's what the best laser will be treating. It obviously is picking up the pigment on a light background a lot better. And we can go all the way to the darkest skin types, so your skin type 6. It's important to know this, and it's important to tell our clients that we can treat every client now, every colour now, because our lasers didn't used to be able to do that. So a lot of the darker skin types have maybe asked in the past and said, no, can't treat you, but we now can. So that's great step in the industry. So timings can vary on treatment to treatment. A underarm can take 10 minutes. It can take 30. A full leg can take an hour. It can take an hour and a half. This is where we just sort of go with our feelings from our consultation. My consultations, again, another important step, so we can give you an understanding of how long the treatment might take. You might want to have a little break in the middle, especially if it's not comfortable for you, so it can prolong treatment and things like that. So we can't ever really give you, we can give you an idea of how long the treatment is going to take, but we can't tell you the exact timings for a treatment. And how many treatments you're going to need. Again, it is going to be how your body reacts to the treatment. So hopefully that's helped in that. The benefits, of course, are removing your hair. Having the hair removed and completely reduced for a very long time. I like to say that it's ever gone forever, but we are reducing and reducing and reducing. I know clients that have come back 10 years after having hair removal and have got nothing in some follicles, but then have the odd little one spot up here and there, which isn't so bad for having 10 years of smooth legs when you go to the beach. I know I don't mind if I can just see 1 or 2 little hairs here and there. It's when you've got a full leg of dark hair, that's when it can get a bit embarrassing and things, and having to get the razors out every 2 days, and a wax every 2 weeks, 4 weeks. So maybe I'm just someone whose hair grows a lot quicker, but it has been a complete benefit for me, and hopefully will be for all of our clients too. Any other questions, feel free to ask, but hopefully that has been a bit more informative on the laser hair removal that we do in salon.